What if there was a healthcare plan that treated your whole health and not just a specific illness or disease? Something that focuses on how your body, mind, spirit, and emotions all factor in to what you're experiencing. Sounds great, right? Well, that's exactly the approach taken at Catholic Health Center for Integrative Medicine and Optimal Health. It's a new program that uses functional medicine and lifestyle medicine to guide patients to health, optimization, and well-being. And we'll learn more about it today on Stronger Together with Dr. Dave. Hello and welcome to Catholic Health, Stronger Together with Dr. Dave. Today, we're talking about Catholic Health Center for Integrative Medicine and Optimal Health. My first guest is the medical director of this program, Dr. Robert Graham. Hi, Dr. Graham, and thank you for joining us today on a very special episode. We're going to talk about integrative medicine, and we're definitely going to talk about food and nutrition. So just from the beginning, what is integrative medicine?
So integrative medicine, my favorite definition is by one of the pioneers, Andrew Weil. He basically says it cherry picks the best of evidence-based medicine in both conventional and complementary therapies. Complementary therapies are everything from acupuncture to yoga, but really the focus of our program is heavily on a food-first approach. Nutrition, exercise, sleep, happiness, community, all those other things that make us well, we embedded into it or integrated into the conventional medical model.
You had two sides. Either you were traditional medicine, Western medicine, which is what most doctors are, or you were quote unquote alternative medicine, which is more Eastern-based medicine. And finally, we are kind of merging the two in a somewhat intelligent model that would best serve the patient.
Yeah.
Do you agree with that?
Oh, absolutely. And I think that the word integrative is intentional. I don't like the word alternative because it's not supposed to be used instead of. Right? So it's not alternative to conventional.
Right.
It's how do we complement conventional medicine with these complementary therapies for where there is an evidence base for its utility. So we're not prescribing witches' brews and things that are sort of new agey or alternative. Really is there has to be an evidence base for its utility, and the magic is how do we integrate that into conventional medicine.
That's fantastic. So, but you're very different than most doctors because you're actually a chef.
Correct.
You're a formally trained chef. So what you've done, which is so interesting and special really, is you've taken medicine and you've taken food and you've tried to merge the two. So tell me a little bit more about that.
And what is the fastest way to access our gut is through our mouth and what we put in it. And so if you try to combine the food system and the health system together, we probably will find the answer to this epidemic of chronic diseases that are mostly reversible or preventable by providing a food-first approach. In medical school, we all learned that the first 6 weeks of a diagnosis, you have to optimize and maximize therapeutic lifestyle changes. The reason why we don't do it is that we're not taught to do that. And part of the training in integrative medicine, functional medicine, holistic medicine, those same sort of similar words, really emphasizes the importance of your lifestyle, things that you can control. And that's another pillar of integrative medicine. We activate and optimize the patient's participation in their healthcare journey. We also believe that the body has its innate healing capacity if we get out of the way of it. And so I feel that, particularly in the US, our diet is the number one cause of death and disability. And so if we can actually start off our care by introducing a food-first approach, then we probably can reduce the amount of medications or procedures that we do downstream.
Amazing. So you said two very important things that I want the viewers to really hone in on. Number one is you said that the body has the ability to heal itself, but we have to give it the opportunity to do that.
Absolutely.
And it sounds like food would be essential in offering that opportunity.
It's the first step.
Absolutely.
Right. It's a step. But I don't want to minimize the role of exercise, movement, physical activity, and also stress. right? And so our prescriptions are real lifestyle prescription first, starting with food.
What are you looking for? You go through my food history, and then where do you go from there?
Yeah, so our intake is very conventional in terms of a history and physical, but our history really dives deeper into what we believe are the 5 ingredients in your recipe to health, right? We started an acronym called FRESH.
Fresh.
Food, relaxation, exercise, sleep, and happiness.
Wow.
And so we want to understand what are those, how are you fresh? What is your food? What is your intake of fruits and vegetables? How much meat are you eating? What type of meat are you eating? When are you eating? When are you not eating? Similarly with exercise, relaxation, how well you sleep. Sleeping is it's an underdiagnosed epidemic. And also happiness. The explosion of research on loneliness, particularly post-COVID, is as significant as a pack of cigarettes in terms of risk factors for cardiometabolic risk factors. So trying to address those sort of lifestyles first. Then what we do a physical, just like any other doctor would do, but then the unique nature of it is the testing. We evaluate your microbiome. We evaluate your hormones, your inflammatory markers. We try to predict diseases before they actually happen using also very unique, innovative biological testing. The explosion of longevity research is very fascinating to me. And we can actually test these markers through lab tests. So we try to predict the disease before it happens, or if you have a disease, what are the modifiable risk factors that we can work together with you in reducing the risk of, or ultimately developing some catastrophic problem.
Is there a diet that you would say, this is the diet I would recommend for everybody? How do you handle this?
My general prescription when it comes to food is eat more plants, right? Because I think the more plants we eat, the longer we will live. And this is based upon thousands of patients, epidemiological studies across the world. In fact, the blue zones sort of highlight that, right? It's that regardless of what you're eating, what you need to do is crowd in your plate with more fruits and vegetables. The standard recommendation is half your plate. I would say push it to about 75% of your plate should be fruits and vegetables. Then we can actually identify the other things that we should be putting onto your plate based upon your disease process. And that's the thing. I think there's a therapeutic diet pattern, right, that needs to be first explored before we start any sort of medication with our patients. I went to culinary school to really push myself in terms of how to design a meal or a plate that is both healthy, nutritious, and most importantly, delicious, right? Because if it's not delicious, no one's going to eat it again. There's so much beauty and flavors in our fruits and vegetables that through the lens of a culinary diversity, I call it, you can optimize and really maximize the flavors of fruits and vegetables. If you speak to most chefs, cooking a piece of chicken, a fish, or steak is pretty easy. You need to season it, but really to get the optimization of our fruits and vegetables, it really is about technique, about flavoring, about selection of quality in fruits and vegetables. And that's what we try to do in our practice, right? We try to guide our patients to make these sort of healthy habits sustainable so that you're not on a diet. The problem with diets is that you're on it and off of it, and it really has to be embedded into the lifestyle.
All right, so Dr. Graham, thanks so much for coming on to the show.
Thank you for having me.
It's been our pleasure. Coming up next, we'll discuss the innovative approach to weight loss and the role your gut plays in optimizing your health. That's next on Stronger Together with Dr. Dave.
Are you ready to open your heart and home for 18 months to a puppy like Esther? To find out more about becoming a canine companion for Independence Puppy Raiser, visit cci.org or call 1-800-572-BARK. You can make a world of difference in the life of a person with a disability.
Welcome back to Catholic Health Stronger Together with Dr. Dave. Today, we're talking about a new program at Catholic Health that focuses on your whole health and wellness. My next guest is Dr. Rebecca Fishman, Director of Integrative Anti-Aging Medicine at Catholic Health. Dr. Fishman?
Hi.
Thank you for joining us.
Thank you for having me.
What is integrative medicine?
So I thank you so much because I think this is something that's very important for the public to hear, right? And people after COVID were really looking for something. They don't want to, what do they do to feel better, to get better? They know they can't rely when everything happens at once. How do they hold up in a situation like that? So people have learned after COVID that it's very, very important to be as healthy as possible. And they're not just sitting around waiting to hear what the doctor says. They're getting online, they're learning, they're educated. And so having this part of Catholic Health is incredible. And I think what Dr. O'Shaughnessy did is absolutely amazing, because we are now bringing this to the public view, and we're offering it to our patients when they never had this before. So basically, what this is getting at the why. So when I went to medical school, when you went to medical school, we basically said, here's the issue, find the diagnosis, and then let's treat that. Here's how we're going to treat it.
Which is many types of medicine. Right?
Exactly.
Yeah.
And that's all good. That's
Right.
what we do. But nobody ever gets to the why. Why? Why are you getting hypertension? Why are you suddenly gaining weight? What is the why behind it? And that's the root cause, right? So if something happens, if something goes wrong, or we have a near miss in the hospital, what do? We do root cause analysis.
Right.
So here what we're doing is we're going, let's figure out why this is occurring. Where is it coming from? Let's get to the root of it. So everything else is a symptom. Right? So most diseases, most chronic diseases, come from chronic inflammation and from insulin resistance. That's really what it comes down to. And then there's other things. So I tell patients when they come on in, listen, think of a stove top. Think of the fact that you have a smoke alarm on top of the stove, and then you have all these burners. And one burner might be sleep. So if I'm not sleeping well, that burner is going to go high. And then another burner could be stress. And if I'm very, very stressed and I'm not controlling that, that burner is going to be up. And if my nutrition's bad and I'm not eating the right foods, my body can't use it, that's going to be up. So eventually all that burner comes up, and now the inflammation goes off, the genes go off, right? You know, sometimes you might be prone to certain genetic issues. That doesn't mean you're going to get it if it's in your genes, but there is a way they get upregulated with all this inflammation. So all that goes off, the smoke alarm goes off, and we get sick. So our goal to optimize our health is to take each of those burners and let's lower them down.
Right.
So let's optimize our sleep. Let's optimize our diet. Let's optimize our fitness, right? Let's reduce our stress load. Let's make sure we have good support systems around us. Let's make sure we're not having any addiction. So all of that, those are the modifications that we can make in our life, our lifestyle modifications, and that will all decrease the alarm.
Tell me more about what you do and what you think is reversible.
Right, like diabetes, type 2 diabetes, that we can reverse those things. It's a lot easier to prevent them from happening in the first place than it is to reverse it, right? So that's what we want to do. And I love when I get patients that come in, because not only am I teaching them, but they're going to then bring that information to their children,
Yeah.
right? So that's really important. We want the next generation and the next generation to be doing the right things.
Do you measure insulin?
We do. We measure fasting insulin. So that's something you can ask your doctor. That is a test that's available. They can measure your fasting insulin. Now, is that the end all? Not necessarily, because insulin happens in response to glucose. So if you're fasting, you're not necessarily seeing what's happening with that insulin. We look at insulin and we look at the glucose, and we kind of figure where the glucose is, the insulin will follow.
Right.
So we try. So there is a way to look at that. The fasting insulin is certainly a way to tell. And there's insulin resistance. You can order a test for insulin resistance score as well. So these are really important, because again, insulin resistance is the key for everything. And the same thing with inflammation.
Right.
Once those inflammatory markers come up, the body calls out, even with fat cells. So as fat cells, there's a difference between white fat and brown fat.
Right.
We have different fat in our body.
And where the fat is, of course.
Exactly.
Right.
So that visceral fat is that white fat. That's the fat that you can't grab it.
That's the fat in your liver, around your organs,
Exactly.
that you can't see.
Right.
So you can actually be quite thin and very unhealthy. If
Skinny
you have a lot
fat.
Of, right. Or
100%.
Right. That same patient comes to you, you find out that they're insulin resistant. What do you do next? Do you put them on a medicine? Do you prescribe lifestyle changes? What's the next step?
So that's a great question. And so it depends on their situation. So first of all, let's say somebody comes in and they are overweight, right? Or they have increased visceral fat. You want to make sure to do whatever you can to reduce that visceral fat. That visceral fat is very inflammatory.
Yeah.
So again, inflammation is going to raise your insulin resistance. The other thing you want to do is not let the insulin go up. I mean, the best cure for getting insulin down is to don't let it go up.
So somebody who's diagnosed with quote unquote type 2 diabetes or insulin resistance, their endocrinologist wants to put them on a medicine, which is fine. We're not saying that's wrong. Are you an option for that patient?
Yes, and so that's the thing. We're very quick to say, again, here's a symptom, right? You have a symptom. Let me give you something for that symptom. But are we really getting to why that's happening in the first place? So you're going to have symptom after symptom, and if they give you a medication, and that's going to help you for a little while, then something else is going to happen. They go, oh, now we need another medication. And all those medications, mind you, they're all wonderful. Listen, I'm a fan of metformin, but they also can cause depletions and nutrient depletions as well. So you have to be mindful of that as a physician. So, people need to be aware that not everything's so benign. So yes, it could help one thing. Are we robbing Peter to pay Paul in other areas?
Right.
But it really is going to come down to, what is the cause?
Right.
Where is it really coming from? Let's get to the root of it. Let's find out
Right.
what the problem really is.
Right.
And that's what makes this so exciting.
We're practicing sick care. We got to practice health care,
Yes.
and this is how we do it.
Yes, and we make a difference for all those doctors, right? So
Yes.
what I love about what we do here, and this is why I think, thank God for Dr. O'Shaughnessy, honestly, to kind of bring this in. It's not just about what we do in our little corner, in our little center. We are going to make that doctor
Yeah.
have better outcomes
Yeah.
as well.
Yeah.
So if as a physiatrist, if somebody came to me and they had knee issues, and they were overweight, it would be a lot easier if they came to me already eating the
Right.
right foods, not eating foods that cause inflammation like sugar. Sugar's the worst. It's the worst.
Oh,
it's
it's the
poison.
worst.
So, should we never have it? No. You're going to have it, but treat it like you have it once in a
Yeah.
while.
You're not looking to replace the
No.
other doctor. You're looking to supplement what's being done.
We're a team.
You're a team.
We're a team. So if you're going to go for orthopedic surgery, somebody needs surgery and they need to have something taken care of right then and there, right? Something's going on, they have to fix it. We can make that better outcome. We can make sure before you go in for surgery that your nutrition is optimized.
Right.
We can make sure that your body is balanced, that the muscles are balanced in the body.
Right.
So there's some things we can do for that, and then as you leave, and making sure that you're healing well,
Yeah.
right? So whether nutrition's for healing, optimizing your sleep, so much happens in sleep.
Right.
That's the big one
Yeah.
too. That's what I think people forget a lot, that the magic happens in sleep. This is game changing. This is next level medicine,
Yeah.
but it's in part of a system. And I think that's what's so great. You're not practicing by yourself. You're in the healthcare system.
Yeah. It's amazing that Catholic Health has embraced this. I mean, this same concept 10 years ago was seen as almost like witchcraft in a lot of places.
Yeah.
And now we realize the evidence has caught up and this stuff really can work in changing lives. We have an epidemic in the United States, and it's kind of scary when we learn that 2/3 of Americans are either overweight or obese. 2 out of 3 people.
Yep.
What's going on?
So it's kind of staggering when you think about the predictions of 2030. By 2030, about 50% of our country is going to be obese.
So not overweight anymore. We're just going to
Obesity.
transition to obese.
100%.
Okay, so with that being said, something very impressive has happened in the last year or so with these new medications.
Sure.
Mounjaro, Ozempic, Wegovy. Tell us more about this.
I think that the GLP-1s, I think that they serve a purpose. They certainly will help reduce that insulin resistance that we were talking about. But I do feel that a lot of people are not doing them correctly. So a lot of people are taking them, and a lot of providers are giving them without getting to the root cause of the weight issue in the first place. So it's great. I think there's a purpose for it. It will help get the ball started.
Yeah.
Get that ball rolling. What I always say, when you start weight loss, it's like a big boulder you have to push. And at first it's really, really hard. And then after a while, hey, it's moving along.
Yeah.
And it has its own momentum. It's a little easier. So it's just starting that's hard. So sometimes that GLP-1 can really come in handy to get them there. The problem is, what do we find? 30% loss of lean body mass.
Yeah, it's scary. And that's muscle. We're talking mainly muscle.
Muscle mass is the currency of aging. We need that muscle mass.
Yeah.
That's the most important. You have to, if you give somebody this, they have to understand that, one, you need to make sure that you're maintaining lean muscle mass.
Right.
Very difficult. If you're 60 and over too, it's not so easy to
No.
gain back that muscle. It's easy to gain back that fat.
Yeah.
So what happens when we lose that muscle mass, our resting metabolic rate goes lower. So now we're going to gain more weight. Our metabolism has changed. So they go off of it, they gain weight.
Yeah.
You might be diabetic and stay on it forever, but if you get people on, we want to get them off.
Yeah.
And you do that by addressing why they gained weight in the first place. Is it because they have a gut health issue, right? Do they have what we call increased intestinal permeability? So are we having a
Leaky
problem?
gut? Is that leaky gut?
That's
Yeah.
where the term people find is leaky gut. Is something getting across, causing inflammation in the body, getting to the brain, causing Alzheimer's, causing cognitive decline, right?
Yeah.
Or is it a stress issue that's causing them to have problems, increased cortisol levels? Is it a sleep issue, right? That's causing the problem. There's so many things that can cause weight gain.
I think you're right. The way I see it is, this is a jump start. How long? I don't know, maybe a year. But if you don't fix what got that person into that
That's it.
position to begin with,
Yes.
they're not going to get off the medicine successfully.
When you put somebody on, one, they have to be building muscle mass.
Yeah.
They have to be working out.
Yes.
People have to be moving. That's one of the biggest problems we have now. We're sitting all the time too. I don't care what it is, you have to be moving.
With all these great new medicines, fascinating medicines, it still comes down to a lot of the basics, nutrition, exercise, sleep. Thank you so much for taking the time out of your busy schedule and joining us on the show today.
Sure.
Coming up next, I'll be joined by oncology specialists who will let us know how the functional medicine program can complement traditional cancer treatments. You're watching Stronger Together with Dr. Dave.
Said I could play, so any chance to play at all. That's my life. I love music.
Yeah, that's how we do it.
Welcome back to Catholic Health Stronger Together with Dr. Dave. The Integrative Medicine program at Catholic Health uses lifestyle modifications, mind-body practices, and natural products from different traditions alongside conventional cancer treatments. To share more about the program and what it entails is my next guest, Catholic Health Director of Functional Medicine and Oncology Rehabilitation, Dr. Jonas Sokolof. Dr. Sokolof, thank you for joining us.
Thank you for having me. It's a pleasure to be here.
Now, there are specialists and then there are super specialists. You are truly a super specialist. So enlighten me and the audience, what exactly is oncology rehabilitation?
Oncology rehabilitation is a field of rehabilitation medicine that is involved, that focuses on restoring the highest possible level of physical function and quality of life for anybody living with or even beyond cancer. So anyone who's diagnosed and has active cancer going through treatment, but also anyone who's survived the disease, so it could be years later, and even has a role to play in end of life in many cases as well.
So when I think of rehabilitation, I'm thinking of somebody who had surgery, is undergoing chemotherapy, they've lost weight, they're weak, they've had muscle wasting, but that's not what this is all about. That is a component of this.
Yes.
Just so you're telling me that, and the viewers, that if somebody has a history of cancer, even if it was years later, they can still benefit from oncology rehabilitation?
Absolutely, because we know that cancer in many instances is a disease that's often associated with lifestyle, obesity, for example, playing a role in at least 12 different types of cancers. So things like, nutrition, physical activity, sleep, stress, those are all things that we can help with to help people survive, to prevent cancer from coming back, and just improve overall outcomes in cancer care.
So an example would be a female who is, let's say, 5 years after breast cancer treatment, and she's feeling well, and she probably sees her oncologist once or twice a year at that point. Is she somebody who should contact your office, and if so, why?
We could help with identifying various factors, metabolic factors, for example, and help optimize and create a lifestyle prescription to help prevent cancer from coming back, such as with exercise or with nutrition.
Why is it important for somebody with a history of cancer or being treated with cancer to exercise? What's the evidence?
Well, the evidence is actually quite strong. We actually have what we call level 1 evidence. So that's scientific evidence that has been done in the form of a randomized controlled trial. A randomized controlled trial is the sort of gold standard in scientific and medical research. We now have an extremely abundant amount of randomized controlled data, high level evidence that supports the use of exercise as a way to improve survival. We know that exercise actually is preventative.
So exercise has been shown to prevent certain cancers.
Has been shown to prevent at least 6 different types of cancers, helps improve survival in at least 3 different types of common cancers: breast cancer, prostate cancer, colorectal cancer, and helps improve what we call cancer-related health outcomes. So things like neuropathy from chemotherapy, lymphedema after removal of lymph nodes, let's say in breast cancer, for example, fatigue, which is very common when people are diagnosed with cancer and go through treatment. Just overall improved level of physical function and quality of life. We know that actually it works like a medicine. It actually is and should be considered a medicine.
People who are being treated for cancer, let's say with chemotherapy, many times they're feeling fatigued and they're just feeling beat up. They actually should consider enrolling in rehab as soon as possible, as soon as they're up to it.
Yes, we have a role to play from the time of diagnosis all the way through treatment, even after treatment, could be even years later. There's always a role for what we do in oncological rehab.
So somebody coming to your office, we spoke about exercise. How about nutrition? Do you go over nutrition? Because a lot of times cancer patients are not counseled on nutrition at all. Is this something that is standard in your oncology rehabilitation program?
In our program it is. We take a very detailed dietary history. Many times we check biomarkers to check for metabolic disturbances, for example. And we can really sort of look under the hood and see how somebody is doing from a metabolic perspective, where diet, nutrition is probably the number one factor, affecting these, issues with metabolism. And then we can help construct various food plans, nutrition programs. We actually have a nutritionist health coach in our practice who can even take a deeper dive with these folks and help guide them along the way.
So with your help, you can actually prescribe an exercise program and a specific nutrition program for a patient.
Correct.
Yeah, that's very powerful, because as we both know, a lot of patients, they're just in the dark, and what makes it a million times worse is then they go on the internet and they're on YouTube or social media, and they have people telling them 1,000 different things they should be doing with zero evidence to back it up.
Right.
So you're the voice of reason in all of this craziness, which is really reassuring. One last thought, as we're speaking, is the nice thing about oncology rehabilitation is, to me, if you're a cancer patient and somebody's talking about rehabilitation, that indirectly to me, that's okay, we're planning for survival.
Exactly.
Right? We're planning for the long term. Yes, you're not sure what the future holds, but at least now maybe you have some hope.
Exactly. You can take a proactive approach. There's a lot that is under your control to ensure that you have the best, survivorship experience.
Dr. Sokolof, thank you so much for coming to
My
the program.
pleasure. Thank you for having me.
Thank you to all my guests today. As we learned today, Catholic Health Center for Integrative Medicine and Optimal Health is a great resource that treats a wide range of diseases. If you would like to know more about Catholic Health or to make a gift in support of one of the amazing programs you heard about today, please visit chsli.org or call 1-855-CHS-4500. Thank you for watching today. I am Dr. Dave Degatti, and I'll see you next time on Catholic Health, Stronger Together with Dr. Dave.